Hi, my name is Dr. Surakshith. I am an endoscopic surgeon, a reproductive medicine specialist, and a cosmetic gynecologist working at Indian Women's Center, Chennai. And as the world rushes towards finding a vaccine for the COVID-19, we have a chance of getting this infection. And in my previous video, I have already given you guys a brief overview about what happens if you get infected by COVID-19 and if you are pregnant. You can check out the video over here. I'll be linking out in this description. In this video, I will give you an overview about what you should do if you think you are affected with coronavirus. There are a few symptoms which you might face, and I'm going to give you some home remedies what you can do. And there are only certain conditions when you actually have to visit the hospital, and I'm going to detail this for you in this current video. This is because there are very less number of tests which are going around, so you might not be able to do a test immediately. Yes, the stress, the anxiety, and the fear is very much real. The moment you have a coronavirus-like symptom, immediately your mind rushes. It thinks about, oh my God, which hospital am I going to go to? Will that hospital have an ICU bed? How much is it going to cost per day? What's going to happen? Am I going to infect my family members? Am I going to lose my life? So because of this, there is a lot of anxiety and stress which is involved. We as Indians are doing very well in the global scenario. Our death rates are very, very, very low. So this is a very positive sign for all of us. I see a lot of hospitals do this fear mongering to make you get admitted into a hospital when you actually don't require any treatment at all, and you might end up paying somewhere between 5,000 to 50,000 rupees per day, and all of this is not warranted. It's only because of a fear you are actually going to the hospital. And if you can just relax and take a deep breath, take a step back, and if you quarantine yourself at home, you will be much more safer, because all they're going to do in the hospital is the same thing. They are just going to quarantine you and they're going to charge you for the day. When we say COVID-like symptoms, what are they? Cough, cold, fever, breathlessness, sore throat, headache, vomiting, diarrhea. Some of them also complain about loss of taste and loss of smell. What should you do if you have any of these COVID-like symptoms? First, make sure you quarantine yourself from anywhere between 7 to 14 days. Make sure your meals are brought to you. Whenever you interact with others, make sure you also wear a face mask and use a separate washroom and separate towels all for yourself. If you have symptoms like cough, sore throat, body pains, or fever, what should we do? For cough, you can take anything which is over-the-counter cough syrup, and you can try alleviating this symptom. If you have a sore throat, make sure you gargle Pipetting solution. So they have these small Pipetting gargles what you get in the pharmacy. You can use those, or mix salt in warm water and then gargle for at least 2 to 3 minutes, and this is a good symptomatic relief against sore throat. And if you have fever and body pains, you can always take a tablet like paracetamol or Dolo 650 for a symptomatic relief. What if you have symptoms of loose stools and fatigue? These two symptoms usually go hand in hand. Because of loose stools, you have severe dehydration. So make sure you are hydrating yourself enough. Drink lots of water. At least 5 to 6 liters of water per day is minimum every time you have this kind of loose stools. Also make sure you take zinc, vitamin D, and vitamin C. And if the loose stools persist for a long period of time, make sure you also have an electrolyte drink, or some of them also have ORS sachets. Both of these are equally useful to replenish the electrolyte loss what you're having. And if any of these symptoms go out of hand, make sure you visit the hospital immediately. And now to the most important and probably the most frightening out of all of these symptoms is palpitations and breathlessness. So every time you have any kind of palpitations or breathlessness, make sure you try to take a deep breath and try to stay relaxed, which is the most important step what you have to do. You need to stay calm. When you feel you have breathlessness and you have that shortness of breath, you feel like there's some kind of tightening in the chest, the first thing what you have to do is try to, as I said, first you try to relax. Once you are relaxed, try to take in 5 deep breaths with your nose. I will just show you an example right now. Hold it there for 1 or 2 seconds. And then let out all your breath through your mouth. So you have to do this at least 5 to 6 times, and once you complete that, the 5th breath, when you completely take it in, cough it out like this. These breathing exercises and relaxing your mind go a long way if in case you are having breathlessness. Another thing what you can do at home if you feel you are breathless is that you can go to your local pharmacy, buy this particular device called as a pulse oximeter. It's a fairly inexpensive device. It's probably somewhere between 600 to 1000 rupees, and this is very important because it can help you find out what your saturation is, or also known as the SpO2. If your SpO2 value is somewhere between 95 to 100, you are absolutely fine. I don't think you need any kind of hospitalization if you feel you're breathless. But if your SpO2 value goes below 95, somewhere between 93, 94, it's time that you might have to go to a hospital. And that do not so that you require any kind of ICU treatment. You might require 100% oxygen ventilation. And when they do that, you will definitely have a symptomatic relief. If you are a chronic smoker, or if in case you have COPD, chances are that your SpO2 levels are always low, and if you feel a bit breathless with a low SpO2 value, at that point of time you can definitely go ahead and get an X-ray done. A chest X-ray is very useful because this will give us some knowledge if in case you have coronavirus or not. There are certain patterns which are found in the lung which are very indicative of coronavirus. So you can always take an X-ray, send it to your doctor friends, and they will be able to assess it for you. My number one rule to you is, if you think you have coronavirus, don't panic, isolate yourself, take symptomatic relief, what I've already explained to you throughout this video, and only if you think you are unable to handle it at home, like your breathlessness goes out of control or your dehydration goes out of control, that's the only time when you need to visit a hospital and get treatment for this. So I hope you found this video useful. I also hope you like the new setup. So do let me know what you guys think in the comments below, and make sure you subscribe to my channel. Alright, so until the next one, guys, thank you so much for listening.